What is Asperger's Syndrome? Asperger's Syndrome or AS is a disorder on the autistic spectrum that affects social interaction and communication. People with Asperger's syndrome may have difficulty understanding social cues and may have a difficult time communicating with others. They may also have an intense interest in certain subjects, which can lead to overfocus on those topics. What are the causes of Asperger's syndrome? The cause of Asperger's syndrome is unknown, but there are environmental and genetic factors that may play a role. Some of the genetic factors that have been linked to AS include abnormalities in the serotonin receptor system, which may lead to problems with body temperature regulation and variations in chromosome 15. The environment can also play a role in the development of AS, as children who are raised in unstable homes or families are more likely to develop the disorder. What are the symptoms of AS? Asperger's syndrome is a developmental disorder that affects communication, social interaction, and restricted interests. As symptoms can vary widely from person to person, but some common symptoms include problems with understanding nonverbal cues, repetitive or obsessive behavior, and difficulty coordinating movements. 1. Problems with understanding nonverbal cues. One of the most common differences between people with Asperger's syndrome and those without is their ability to read body language. People with Asperger's syndrome may misinterpret the nonverbal cues given by others, often leading to misunderstandings or dangerous situations. People with Asperger's syndrome may miss cues that other people take for granted, such as facial expressions or tone of voice. This can lead to miscommunication and difficulty forming social relationships. It is important for people with AS to learn how to read body language and pay close attention to the words being spoken to avoid misunderstandings. 2. Repetitive or obsessive behavior. Repetitive or obsessive behavior is a common feature of Asperger's syndrome. People with this condition may tend to repeat certain actions or rituals over and over again, even if they don't have any specific goals in mind. They may also obsessively check certain details or spend hours planning specific activities in detail. All these behaviors can be disruptive and can lead to problems in everyday life. However, people with Asperger's syndrome are often very successful in some areas, such as mathematics or engineering. 3. Difficulty coordinating movements. People with Asperger's syndrome have difficulty coordinating movements. They may not be able to understand or follow directions properly, making it difficult for them to do everyday tasks. This can include problems with getting from one point to another, making simple movements, or coordinating two or more movements. What is the difference between Asperger's syndrome and autistic disorder? Both conditions are characterized by difficulties with social interaction and communication. People with Asperger's syndrome also often have problems with repetitive activities, such as rocking back and forth or fixating on certain objects. In contrast, people who have autism usually have more severe difficulties with social interactions and communication. They may also have more difficulty focusing on tasks and seeing relationships between things. Asperger's Syndrome Test. Asperger's syndrome is a neurodevelopmental disorder that affects communication and social interaction. To help diagnose Asperger's syndrome, doctors may ask the person to take a test called the Autism Spectrum Quotient, AQ. The AQ is used to measure how well a person understands social interactions and communicates. What is the treatment of Asperger's syndrome? Asperger's syndrome is a developmental disorder that affects social interaction and communication skills. There is no known cure, but treatments can help manage symptoms. Therapy and medication are often used to help improve functioning. Some therapies that have been shown to be helpful for AS include cognitive behavioral therapy, CBT, occupational therapy, OT, and parent training. CBT involves teaching the person with AS how to change their thoughts and behaviors to improve their social interactions. OT helps people with AS learn how to control their body movements so they can better participate in social activities. Parents are often taught about AS and how to interact with their child with AS so they can provide support both at home and at school. Medications that can be used to treat AS include antipsychotic drugs, antidepressants, and mood stabilizers. In conclusion, Asperger's syndrome is a disorder that is often misunderstood. However, with the right support, people who have Asperger's syndrome can lead happy and successful lives. If you or someone you know has been diagnosed with Asperger's syndrome, don't hesitate to seek out help from a therapist or other support groups. If you enjoyed the video, please like, subscribe, and share for more videos like this.